Hi, this is Denise with HealingHacker.com, and I am here today talking with Henry Ehrlich, author of Traditional Chinese Medicine, Western Science, and the Fight Against Allergic Disease. Thanks for being with us today, Henry, to talk about your new book.
Well, thank you very much, Denise. It's good to be back.
So what I'd love for you to do is, and I know that Dr. Li is also a co-author, but what I'd love for you to do is to cover how this book is an expansion or a deepening of your first book, which was Food Allergies and Traditional Chinese Medicine.
Okay, well, just for the record, this is the first book, and this is the new book. The first book concentrated on food allergies, of course, as the title implies. This one updates the earlier research. It shows where it's come and where I hope it's going to go. But the biggest chapter in the new one was about Dr. Li's work with asthma. The earlier book easily could have been both food allergies and asthma, but I decided to just concentrate on one. Her work on an investigational new drug called ASHME is very advanced. It's been through clinical trials in China, and this book tells about that drug in great scientific detail, as well as my own preferred anecdotal recap of what it all means. The ASHME has been shown to be as effective in suppressing allergic asthmatic inflammation as systemic prednisone, but without any of the side effects or cytotoxicity that steroids commonly produce, especially in the systemic form. So that's a big deal. There are also mental health aspects, both of asthma and of asthma treatment, that show up in the blood chemistry. The ASHME does not share those problems, so this is potentially a great boon to the 300 million people worldwide who have asthma, and I don't know how many of them have moderate to severe asthma, but they particularly stand to benefit from this drug. So that's the biggest chapter in the new book. I also deal with atopic dermatitis, which I dealt with a bit in the first book, but in much greater detail. Dr. Li has a treatment for atopic dermatitis, also known as eczema, that shows promise for actually shutting down or at least stalling the atopic march, which would be a boon. Your viewers may know that eczema is considered the first step in the atopic march, and is a precursor to asthma, environmental allergies, and food allergies. So that's a very important chapter. My personal favorite chapter is about mast cell activation syndrome, which is a big problem with a lot of uncertain diagnosis. Until 5 or 6 years ago, there was never even a name for it. Now it has a name, and it has a kind of a crazy quilt of treatments that can be given that have been pieced together by some very good scientists in Boston and New York and elsewhere. However, the crux of this particular chapter is a single case history of a young woman who over 5 years experienced which is a typical arc for between the onset of symptoms and giving this disease a name. And it's a very moving and interesting chapter. She's a very interesting young woman who with her family experienced terrible travails and trials with this disease. Then there are other allergic diseases, and finally, Dr. Li closes with an essay about the directions of her future research. So that's the book in short.
You mentioned two things that I hope you can expand on a little bit, and ASHME. talk about ASHME a little bit. I have not read the new book, so I don't know the full details, but does the book talk about what does the treatment protocol look like as compared to oral steroids? Is this a lifelong sort of you're on ASHME forever, or you're on ASHME for 6 months and then you're good? Because also in the somewhat synopsis of the book, you make a bold statement saying, I think the direct quote was, Dr. Li is healing people's immune systems. So that insinuates a sort of treatment time and then you move on.
Yeah. Well, that's a very good question, Denise. ASHME, it looks like, and there are several case histories of Dr. Li's treatment of asthma, which does take place. It isn't ASHME per se, because that's an investigational drug. It's made from 3 herbs, which are continually being refined. But her treatment of asthma is noteworthy for several reasons. First of all, it does treat, doctors refer to asthma now as a syndrome. It's a collection of symptoms. It's not a discrete disease. Most of it is allergic asthma, also known as eosinophilic predominant asthma. Eosinophils, as your EOE readers know, are a white blood cell that is drawn to inflammation. Not everybody who has asthma symptoms has eosinophilic asthma. There's also something called neutrophilic asthma, and there are many different phenotypes. That is to say, individual or particular symptoms that manifest in different, or symptoms that manifest in people whose physiology is somewhat different. The thing about ASHME is that it seems to quell the pathways of different kinds of asthma. Eosinophilic asthma predominates in 3 different pathways. I think it's IL-4, 5, and 13. There's also 17, and there's just a whole arithmetic and alphabet attached to different kinds of asthma. This does seem to work across a broad number of these pathways, so that's a very good thing for people who have these symptoms. Progress can be measured in very short periods of time compared to, say, food allergies, for which the symptoms are usually invisible for a long period of time, and it's hard to track the progress of food allergies in the same way. But if you stop taking your albuterol and you stop taking your corticosteroids, that is a measure of real progress. Yeah. And there are other ways to measure it as well, and that does take place in a relatively encouraging time frame, and it is long-lasting. Dr. Li projects that eventually, when this becomes a common way of treating asthma, that there may be a periodic booster course of treatment. But the accounts of how much better people's lungs are over a really relatively short period of time compared to the misery that they suffer in the months and years leading up to it is really, to me, very profound and a very good story. So that is, I give one case history of a very interesting woman on the West Coast who's in her 60s now and has suffered from allergic diseases her whole life, and she didn't let it slow her down, but she was having to schlep oxygen all over the world, as well as her inhalers, and now she's living a very robust life, and I enjoyed bringing her story into this book. So is that...
Well, it sounds like you have a lot of case studies and also kind of an overview of the clinical trials that she has in different phases.
Yeah.
Okay. I did want to ask you another thing, and something going back to the ASHME. You say investigational drug. So has it moved from just being something that Dr. Li is using in her in clinical trials and in practice? Has it progressed on that spectrum of approval towards, for lack of a better word, drugdom?
Yeah, the empire, the dark empire. It has not been a phase 3 trial. The earlier trials were both in China. They were in a specialty hospital for asthma. They were very, very encouraging. But to gear up for a full-scale set of FDA trials is a cumbersome and expensive proposition. Interestingly enough, there is a bootleg version of ASHME out there, and Dr. Li had to foreclose the use of that word because it is trademarked. As I say in the new book, it's easier to get trademark enforcement than it is to get patent enforcement. But that's not to say that it doesn't work. Alternative practitioners have approached her about trying to get access to her version of this drug. And I sat in a meeting with some of these people a couple of years ago, and it was fascinating to me. I would like, it's important to remember for all of your viewers that there is a dual regulatory system in this country, and one is, of course, the FDA full, 3-phase trial, big rollout, double-blind, et cetera, placebo-controlled route, which is anticipated to go forward. But all of these drugs that Dr. Li has invented and so forth are available, can be used as supplements without the same kind of regulatory scrutiny. They are licensed under the National Center for Complementary and Alternative Medicine structure under the NIH, and they are not subject to the same kind of approvals that a regular NIH trial would take place. So some of these things are available under this dual regulatory structure, and of course that is the basis under which she operates her own private practice.
Got it. Yeah. I want you to talk a little bit about so what new sorts of insights so ASHME is much more covered in the new book. What sort of inroads as far as food allergy goes? Have you guys gone back to the FAH F2? Where is that in development? Is that covered in the book?
Yes, it is a bit. There is a refined version, BFAV2, that I did mention in the previous book that is being trialed, but it's an interesting thing about Dr. Li, however, because she is a powerhouse visionary in she says she's not a chemist, but she knows how chemistry works, and she's got a crack team of people working on it, and so there are further refinements going forward that I think will be very exciting. It's not appropriate to talk about them now, but you have to be patient, and her patients have to be patient. She does have this dual career, which is to say that she's a full-time scientist and a part-time healer. So that interplay between her practice and her laboratories is really astonishing to watch in action. She learns things in private practice. She learns about patient aspirations and so forth, and is able to bring them back to her lab and ask people to investigate how to make these things happen. It's very interesting. She does write about that in her introduction to the book a bit, and then again in the last chapter about the future of her research. She is really breathtaking in her vision. For me personally, it's a pleasure, but it's a challenge to keep up with the way her mind works. So
I can imagine.
That comes through in this book, I hope.
Let's talk about that. So what is the future of her research that is detailed in the book? What are we looking towards? What are we looking forward to?
Well, we're looking forward to an accelerated uh, timetable for her food allergy treatment to take hold. You know, she's fully aware, and she talks about this, and we talk about it in the book, that the regular way of using traditional Chinese medicine is not really to any American's taste, and even in China it might be difficult to brew tea every day out of a bunch of herbs and drink it. You know, Americans just don't like it. Refining it into pills, as we described it in the last book, it also presents its challenges. You know, you asked about, and we explain in the new book, that the previous trial it was a 6-month trial for phase 2 didn't go terribly well. It was too short, and it was too many pills. And I explicitly discussed that in the last book. You know, the trials which were just in equipoise when I wrote the first book, then turned out to be not the ringing success everybody was hoping for, and many people were disappointed. But Dr. Li and her team at Sinai, often in collaboration with scientists back in China, have now arrived at ways of refining those drugs to make sure that the active ingredients survive the refining process and can be presented in much more concentrated form. So whereas the previous trial was 30 pills a day and taken at 3 different times of the day, it'll now be 2 pills 3 times a day, or maybe even less in time. That will be a tremendous boon to patients who really just can't bring themselves to swallow all those pills all the time. So that's very good news as far as I'm concerned. And the marvelous part of this, from a Western medical point of view, is that all these things are being done according to protocols that are not that are proven. The fingerprints of the active ingredients are being measured and constantly studied, and they are to all our regulatory standards. So this is a great thing to me, and I hope it will be to your audience as well.
Yeah, no, I was reading about that study, yeah, and we were taking the food allergy herbs for a while. I don't think it was FAHF2, but it is daunting to swallow that many pills, especially with children. You know, 3 times a day, there's school, there's all these logistical things, and I hate to be such an American about it, because it seems, you know what I mean? It's like, oh, just give me my magic pill, but it made compliance really difficult for us, and what we had to manage. Is there anything else that you want to cover that's about the book?
Well, yeah, I would like to say something about atopic dermatitis, which is of course the first step on the atopic march. Her treatment for atopic dermatitis is the most advanced treatment, and we are now, I'm proud to say, I'm actually instrumental in putting together a practice network of physicians who want to offer some of these treatments in their practices. You know, you look at pictures of little kids with eczema, you know, infants with eczema, you know, with as soon as they grow fingernails, they start to scratch themselves terribly, and that's a really heartbreaking thing to watch. And the standard of care, of course, is topical steroids and so forth. So a doctor, I'm not going to name him, has now signed on as the first satellite bearer of this treatment to two patients who conform to very, very miserable standards of skin health under current treatment, and so that is a big thing. I've been pushing it, and Dr. Li has responded. So that's exciting to me.
Well, let me ask you another question about that since you bring that up. So you mentioned earlier on in your discussion about eczema that, and I don't remember exactly what you said, but her treatment can halt the atopic march.
Yes.
Does that mean that someone comes to Dr. Li's treatment as an infant early on with eczema, and so one can safely assume, oh, the atopic march is beginning, and she has completely kiboshed that whole process, and that child is now not at all even on that atopic path?
Well, first of all, you know, forever, or even the first 5 years of a child's life is a long time. But the most important thing about it is that the recent theory about the induction of peanut exposure, particularly by the same people who did the LEAP study in London, is that ingestion of allergens is not the principal entry point for allergens, that it is the skin. Yeah. And so if you can repair the barrier, or at least shore up the barrier of eczematous skin using a treatment like Dr. Li's, which is a combination of oral and topical medicines, it's baths as well as creams as well as things that you swallow, you can shore up the barricade against the induction of these allergens, and in the process you can calm the immune system more broadly so that it may stave off the development of some of those other things. But since it is the first step, and we worry, of course, when it's bad enough on its own without worrying about it as an induction point for a bunch of peanuts that Dad ate while watching a ball game on the couch the year before. Then to me that's a net plus. I'm not a scientist. I'm not even functioning as a publicity agent here. But I do find this kind of possibility to be very interesting and encouraging, and I speak about it in the book, really rather modestly, but I do get excited about it personally.
Well, I think given the landscape of treatments available for allergic diseases, which run the gamut from, it's a combination of avoidance, steroids, epinephrine, albuterol, that whole spectrum of things. I think given the availability of what's out there as treatments, what Dr. Li is doing is definitely exciting. Well, thank you so much for your time, Henry. I look forward to reading the new book, and congratulations. And I also look forward to seeing what's on the horizon with Dr. Li.
There is a lot more in prospect, and I look forward to helping tell that story.
All right, great. Thank you so much.
Okay, thank you so much, Denise. Bye.